Hello, good afternoon, everybody, and thank you for joining us today. Apologize for the couple-minute delay. We're working to ensure that this webinar goes smoothly for you. My name is Cameron DeYoung, and I'm the Digital Marketing Manager here at EMDs, and I'll be your moderator for today's presentation. In today's Practice Partner Lunch and Learn, we're going to continue our discussion on enterprise prescribing. Before I hand the presentation over to Susie to get us started, there are some housekeeping items I'd like to cover. Today's session is being recorded and will be made available to participants after the event. You'll receive an email with a link to the presentation slides as well as instructions on how to access the recording. All attendee lines are in listen-only mode. If you have any questions during this presentation, you can use the Q&A and chat tools to submit them to our team. We'll handle all the questions at the end of the presentation. If we're not able to get to your question during the live session, we'll make sure to follow up with you directly after the webinar. On your screen, you should be able to see the slides for today's presentation. To view a full screen mode of the presentation, please click the arrow icon in the top right-hand corner of the presentation screen, and that will maximize your view of the presentation. Okay, that does it on my end. So without further ado, I'm going to pass the presentation over to Susie to get us started. Thank you, Susie.
Thanks. Thanks, Cameron. Hi, everybody. Thanks for joining today. Elena is going to present today some more enterprise platform strategy and the new e-prescribing features coming our way. So I just wanted to kind of start off and introduce her a little bit on that. Also, just want to remind you, we are in the last quarter of our regulatory reporting, so hopefully everybody's got all of their stuff going and making sure that everything is recording and their reporting is on cue for the end of this year. All right, so I'm going to go ahead and pass it on over to Elena, and she'll go ahead and start the presentation. Thanks.
Good afternoon, everyone. Thanks so much, Susie and Cameron. I'll go ahead and share my screen here, and Susie, just let me know when you can see that.
I can see it. Thank you.
Great. All right, everyone. Again, thanks so much for joining us. I'm really excited to share these great new features coming to Practice Partner. We've got a lot of work being done to make sure that these features are done in a way that is really user-friendly and helping your workflows. So these are great new things that can help increase the communication that you have between your practice and the pharmacy. I have several screenshots within the slide deck that I'd like to share with everyone. And I also have planned some live demonstration after the slides just to show some more actually within the product. So I'll go ahead and get started with our RX Cancel, RX Change, and RX Fill features coming in Practice Partner version 11.2. Before I get started also, I want to encourage everyone to ask questions while we're talking about these different topics. Please feel free to post your questions in that Q&A section so that we can pause every now and then and take a look at those questions, and I will answer whatever I can immediately, and anything I can't, I will get back to you. So again, please don't hesitate to ask any questions that you have in that Q&A section. We'll start out with RX Cancel. This is a feature that EHR vendors are required to implement as part of the ONC 2015 edition certification. It's also functionality that has to go through a SureScript certification as well. So this feature is double certified with the ONC and with SureScripts. It's a process that EMDs is going through to ensure that these processes and transactions are happening per all of the requirements. When RX Cancel is used, there are a couple different things that could be happening. One scenario is that if a prescriber would like to correct a mistake that has been made on a prescription that was sent electronically. So RX Cancel can only be used for electronic prescriptions that have already been sent. So say, for instance, we send a prescription today, and then a couple hours later, or maybe even a few minutes later, realize after it's been sent that there was a mistake. Instead of having to pick up the phone and wait on hold possibly and go through a whole lot of waiting, I could immediately go to that script within my system and send an RX cancel message electronically to the pharmacy, letting them know that that prescription has been canceled. Another scenario is that if the prescriber would like to discontinue the therapy of a prescription that still has refills left on it or is still considered active, a lot of times we've heard from our providers that they are getting refill requests from a CVS or some big name pharmacy, and they continue to receive those refills even though they've discontinued the med on the patient's med list inside the EHR. Now we're going to have the ability to discontinue the medication within the patient's medication list and send an electronic cancel message to the pharmacy to let them know, don't ever refill this again or ask me for a refill request on this medication again because it is being discontinued. So hopefully that will help to ensure better communication between the practice and the pharmacy. Something to note on RX Cancel is that it can only function if both the pharmacy and the EHR have this feature enabled. So an important note here, when we are in the medication screen in Partner and we have a medication highlighted that we would like to discontinue, we highlight that medication, click the discontinue button at the bottom of that med screen, and this discontinue medication window that's shown on the bottom section of the screen on the right side will appear. So by selecting a radio button from the list, we are selecting the reason that is saved to the EHR for discontinuing that medication. If the pharmacy that is being used for this prescription has RX Cancel enabled, meaning they've gone through their vetting process and completed their update to enable this new transaction or this new message type, you will see that checkbox at the bottom of the screen that says Send Cancel to, and it'll name the specific pharmacy that this prescription is being sent to or had been sent to in the past. If that checkbox is there, that means that pharmacy is capable of receiving those RX Cancel messages. If you do not see that checkbox, that means the pharmacy that this prescription is associated with does not have RX Cancel capabilities. So as we're moving through 2019 and into 2020, more and more pharmacies will begin to adopt these new features. Probably at the beginning, first half of 2019, we won't see too many. But as we get closer to 2020, we'll see more and more pharmacies begin to adopt these new features and implement them. So I just want to make sure that everyone is aware we will not present the option to send an RX Cancel message unless we are completely sure that the pharmacy has all the capabilities necessary to receive it. Have we gotten any questions so far?
No, not yet, Elena.
Okay, thanks. RX Change is the next new feature being added with Practice Partner version 11.2. There are several different circumstances for an RX Change message to be received from the pharmacy. Now, in this message type, we are having kind of an opposite transaction from RX cancel. When we started talking about RX cancel, we are sending a message from the prescriber to the pharmacy to inform the pharmacy of a change or a discontinuation. That's a message from the prescriber to the pharmacy, and that's RX cancel. Now, when we're talking about RX change, this is a message or transaction from the pharmacy back to the prescriber, and that will always be the message direction for these RX change messages appearing in your medication list. So an RX change message is coming from the pharmacy when the pharmacy has identified a need to make a change or clarify the original prescription. There are 3 different types of RX change messages. There's therapeutic interchange, generic substitution, and prior authorization. So we can receive RX change messages of these 3 different types. The pharmacy will decide which type that they select to send you, and you will see on the screen which type it is so that you can make your best decision. Just another note here, are pharmacies required to support all RX change types? No, they're not. They are not required to support all of them, and they're not required to support any of them at this time. So, again, an EHR vendor that's providing customers a 2015 ONC certified software is required to make these features available, and it also requires a SureScript certification to enable these transaction types, but they will only work if the pharmacy you're sending to or working with also has these features enabled. So this is going to be a reason why the pharmacy management screen and being able to see those service levels on the pharmacy management screen is so important, because you might be receiving some of these messages and wonder, well, why don't I ever receive one on this other patient? And you can take a look at that pharmacy and hover over their service level icon. We'll go over that here in the live demonstration in a little bit, but you'll be able to tell, well, this pharmacy is not enabled for RX change, so that's why I'm not receiving those messages. So we are trying to make sure that you have all of the visibility into the information you need and make those best decisions possible. So we'll keep going here. The first RX change message type we'll talk about is prior authorization. So the first release for prior authorization RX change messages that we'll be seeing is kind of a light version of communication for prior auth. We will be building upon the prior authorization workflows in our partnership with CoverMyMeds, but that will come later in 2019. The initial release will have this feature, though. So if we receive a change request from the pharmacy that is of the prior authorization type, the change request will appear to us like this inside of the SendRx screen. So let me just get everyone oriented to the screen itself. At the very top of the screen, on the left side, we can see the patient that we're working on. We will always keep the patient context in view while we're in the enterprise prescribing workflows. Then across the rest of the top of the screen, we can see all of the rest of the pending medications that are waiting for action for this patient. Typically, I don't think we'll see a patient with 10 medications waiting for action, but I did want to fill up this patient's chart so I can show you a bunch of different features. So in this case, it's just a test patient, thank goodness. At the top of the screen, so we can see that this patient has 10 medications waiting for action. The action section of the screen does have a scroll bar to let me scroll down and view the rest of the medications. When I click on a medication from the top section of the screen, I am shown the details for that medication. So I have received from the pharmacy a change request, and I can tell that by the middle section of the screen on the details that this is a change request. And then a little bit lower, I see that a prior authorization is required. Here I'm able to state for this change request whether I approve the change. So I enter my prior authorization and then click approve, or I deny and say, no, I'm going to stick with my original, and I'm going to maybe contact the company and work through the process without responding to this change request from the pharmacy. Or I can say payer not contacted and let the pharmacy know we're not going to contact the payer. So there are several different ways to respond. If, though, I have that prior authorization number, I can click that edit button in blue and enter that number. That number does have to be filled in before I'm able to click approve. So that is one example of how I would see a prior authorization change request coming into the patient's pending med list or queued med list. Are there any questions at this point, Susie?
I have one question that came up, and is there any due date in 2019 to install these features?
No.
Okay. Okay. Thank you.
Yep. As a vendor, EMDs is required to make these available, but you as the practice can make the decision on when you would like to perform that update. So throughout 2019, we'll have more and more information available for you on all the features coming and what they are and how those timelines look for you so that you can make those decisions on when you'd like to perform those updates. Great question. So this is just another example of how that prior authorization field will open up for me to enter the number or character sequence, whatever it may be. Clicking that checkbox will allow me to save the number, and then I'm able to click the approve button. Once I click approve, this queued or pending medication will be removed from the screen, and then I can start working on down the list. So, for instance, if I'd like to work and take action within the details section of the screen, I can do so by clicking the approve button or deny button in the middle of the screen, or I can use the action drop-down in the top section of the screen to state approve or deny. This is a lot of text, but I'd like to just quickly go over the use cases for generic substitution Rx change messages. So in the past, we've had a few questions on why a pharmacy might send a generic substitution Rx change message to the prescriber. Here's just some information on what those scenarios might be. Maybe the pharmacy would like to switch from the brand to a generic. Another scenario could be that there is a new generic available that the pharmacy may have just received, and they'd like to ask if you would, as the prescriber, like to approve that change. Or maybe the brand is not covered and the pharmacy is asking the prescriber to make some type of substitution. So these are three scenarios in which the pharmacy would be sending a generic substitution or exchange message to the prescriber to see if they would like to make any changes. When we receive a generic substitution or exchange message from the pharmacy, it will look like this. At the top of the screen, we can see that the selected medication has its details shown in the bottom section of the screen, and that it shows it is a change request in the middle column, and it is of the type generic substitution. So I can see that the pharmacy is requesting this generic substitution, and some details there. When the pharmacies send these types of messages, they can send up to 9 different options in their message. It's pretty rare when these messages actually start being used to see 9 options coming from the pharmacy. Usually it's 1 or 2 or 3. But they do have the option, and we do have the capability of receiving 9 different options. The way that you are able to see those different options is when that See More Generics Available hyperlink is visible in the middle column. So if the pharmacy has sent multiple options for the substitution, that See More Generics hyperlink will appear in the area where we're seeing details from the pharmacy. And it'll open up in a smaller screen with a list of the medications and a radio button next to each one. So you'll have the capability of selecting one of those substitutions and clicking OK. If a different one is selected from what we see on the screen right now, it will then refresh with the selected medication, and you will then have the ability to select the Approve or Deny buttons at that center column. So again, we have the ability to make a decision while we're looking at the details here by selecting Approve or Deny. Or we can make that decision at the top section of the screen by selecting the checkbox next to the medication and the drop down for the action. The reason why we have 2 ways of taking action on the medication is because depending on the scenarios, you may want to click the checkboxes at the top of the screen, select your action, and quickly send all. But if further review or a more detailed review is required, you may need to take one medication at a time and make decisions while looking at those details. So both workflows are made available here, just depending on what you prefer. Also keep in mind that when we are approving or denying a change request, we are simply approving or denying that request for a change to the original prescription. We are not approving or denying the original prescription because you've already written that prescription and sent it to the pharmacy. Therefore, you approve it. So if I receive a change request and select Deny, that automatically tells the pharmacy continue on with the original prescription that was written. If I receive a change request and make a selection for a substitution and click approve, that means do not fill my original prescription. Instead, fill this substitution that I have listed here. Do we have any questions so far?
No, all's good. Thank you.
Okay. I know it's a lot of information coming pretty quickly. So our last RX change message type is Therapeutic Interchange. And there are about 4 use cases or scenarios in which the pharmacy could send a Therapeutic Interchange RX change message to the practice. These are a little more detailed, but this slide deck will be made available for your review in case you need to refer back to it. So I wanted to make sure the information was available. But a couple different items here: formulary compliance change to an on-formulary or preferred drug, maybe a claim rejection would then prompt the pharmacy to request a therapeutic interchange from the prescriber. Or maybe a daily dose optimization situation. It could also be a clarification that the pharmacy would like to ensure they are filling the appropriate dosage. Again, this is all to try to keep these communications, the back and forth between the practice and the pharmacy happening documented, electronically saved within the EHR, and keep everybody off the phones as much as possible. So this is allowing the communication between the practice and the pharmacy, or the pharmacy coming to the practice, to happen over your applications, so you can make decisions as you're going through your day rather than receiving phone calls. So a therapeutic interchange message will look pretty similar to the other change messages you're going to receive. Again, we can see that message detail section, the middle column, states that this is a change request coming from the pharmacy. And we've got the type listed there. It is a therapeutic interchange. And it's also in the header, we've got script clarification. So the pharmacy is letting us know that they need some clarification on the prescription. And again, we can either approve that change or deny it. If we deny, we are saying, I deny this change and I want to move forward with the original prescription that was sent, which is over on the left side, and that's there for your reference. If you need to make any notes to the pharmacy during this process, you can send those by clicking on the small edit button in the Notes to Pharmacy in that middle column. Just a couple more notes on RX Change. It again, like RX Cancel, is required for 2015 edition certification, also requires a SureScript certification, and as we mentioned before, when the pharmacies send those RX Change messages with alternate options, they can send up to 9. So if they do that, you'll see more alternatives or hyperlink up here for you to look at those different options. The last message type that we are going to be introducing today is called Exfil. This is a feature, again, that we're required to implement according to the 2015 edition certification. And Exfil functionality also requires SureScript certification. side note here, though, is that SureScripts is not yet ready to activate this message type in general across their network. They are preparing for that and getting ready to do so. But since SureScripts isn't even ready to turn it on, you can expect that the pharmacies are a little further out from being able to implement this message type. This one will be extremely useful, I think, for practices working with chronic care patients, or maybe just trying to keep track of the fill rates and how their patients are doing as far as keeping on track with their medications. This will be really helpful to know and be able to look inside of your patient's record to see if the patient filled the medication, or if by chance the pharmacy was only able to fill half of the prescription, and then they'll get more in stock and they'll have the patient come back, something like that. So those are all Exfil messages that can come from the pharmacy and into your system to help you understand more about the whether or not the prescription was filled by the patient. Again, for this message type, we do have to have both the vendor, the EHR vendor application, and the pharmacy application enabled for this message type before it can work. But once we have more of those pharmacies enabling this, we'll see a much more adoption. And then, of course, we've got to get SureScripts up and running with it as well. So much more to come on this one in 2019. We will be able to see these messages within the patient's med list on the Fill History tab. So if we click on a medication and then click the Show Detail button at the bottom of the screen, we will have this medication fill history detail window appear to give us more information on what happened after we sent that prescription over to the pharmacy. Now, coming also in 2019 are different levels of alerting the prescriber to these fill messages. If you work at a practice or are a prescriber that does not need to know these fill statuses or be alerted to them, you will have the ability coming later next year to state that you don't need to be alerted, just save them back into the patient chart and no other alerts necessary. Or if you're working with a certain patient group where you really need to know those fill messages and those statuses, then you can select to be alerted, and those will come into other areas rather than just in the patient's chart, so that you can be alerted to the fill status. So more to come and more features to be built upon this functionality later next year. So before we move into the live demo portion of the webinar, I'd like to just ask again if we have any questions. Okay. I do want to make sure everyone is aware that I am going to be displaying an environment that is in development still. We are still working and developing and making changes every day. There's a lot of testing happening. I would fully expect to be some maybe an error message or some different things happening that we would not expect to happen when we go to production. Since we're still a ways out from production or being ready for production, we will still see some issues occur within the environments. But I do want to make sure that everyone has the exposure to these new features and functionality well in advance to the actual release, so that you can become familiar with it. So let me get us situated here. While we're in a patient's chart, I can go to the medication section as usual and see our allergies and current medication list. One of the things that I'd like to show everyone, it's been a while since we took a look at the new allergies, but if we click on allergy here now, we'll see a new screen pop up for our enterprise allergy management. A couple more items and UI things have come up with our review with our physician panel to increase the usability of this screen. So a few small changes are still being worked on for the screen. But for the most part, we do have a good view of what the allergy management will look like. As you can see on the left side here, I have my full list of the patient's allergies. I can hover over and see some details about that allergy. I can also see that I have a free text allergy heading and an allergy listed under here. So just by hovering over this little info icon, I'm being told here that a free text allergy will not be screened for interaction checking. So for new users on the enterprise, it will be probably pretty common to see these free text allergies appear. We do have quite a lot of historical data coming from a whole lot of different places. What we'd like to do is, now that we have a great new system to enter allergies, we want to encourage these allergies to be entered in a codified way, meaning there is data behind this text to tell your system that could be an interaction with a new prescription being prescribed, or there's data behind that allergy being saved to your database for your reporting vendor to pick up on, or for maybe a health maintenance rule to pick up on. These are the kind of things that can help us better communicate with other areas of the system as well as our vendor partners when we're working on patient data. So in order for me to change this free text allergy into something that's codified and has more information behind it, I can edit this allergy. When I edit, I'm already warned that this allergy will not be screened for drug interactions. It's in the free text area. But if I take this allergy and search our coded area, I can now select it from the data that is presented to us with all of the content from coming directly from First Data Bank and make this selection here. So now you can see that I've changed that free text non-coded allergy over with just a few just a few seconds of time and made it into a coded allergy for me to save. I can add any reactions I need to. Maybe there's some swelling as a reaction as well. I can add that. Any comments that I need to, and I can also click Save down here. And if you'll notice, the free text heading has disappeared now. I have all of this patient's allergies now saved as coded allergies ready to be used with any partner or all over the rest of the system to make sure that all interaction checking is happening appropriately. Do we have any questions about allergies before I move on?
Nope, not any allergies yet.
Okay. Boy, everybody is very quiet today. So I'll go ahead and click Save. And you can see that the screen here was updated automatically, and now I have the swelling reaction added as well. One of the last things that I'd like to show is that if I highlight a medication and click discontinue, we are able to see that discontinue medication screen pop up. This is the enterprise discontinue reason screen. And again, we can see that this pharmacy had the RX cancel message type enabled. So I can check this box and make sure the pharmacy knows not only do I want to discontinue this medication from the patient's current med list and move it, I also want to let the pharmacy know not to send me any refill requests for this med because it is being discontinued. So this allows me to electronically tell the pharmacy. Okay, well that is the bulk of what I had today. I was expecting a few more questions, so if you've been holding any questions, please feel free to type those in. And Susie, did you see anything that prompted any questions on your end?
One question came up, and it did the last Lunch and Learn, was the workflow for changing medications from current to historical in the workflow. So that is there. I don't know if that's a process you can kind of show them to see how that works.
Sure. So we've got our lisinopril listed on our current med list, and I want to discontinue that med. Oops, I clicked it twice. But I would be able to click that. I think I need to discontinue the med and take it over to our historical tab. Does that make sense? Is that very different from what had been happening in the past?
Well, I think mostly because in our templates we had the duration, or the duration dictated, you know, what pushed over to the historical. So if you had something like an antibiotic and you had 10 days in there, it would automatically push. So now with Enterprise, we don't have that logic of the frequency. So it's a more of a manual. When they're in their workflow, they'll be discontinuing it and moving it over to historical as they, and even if they go to renew it, that kind of thing too. Isn't there an option where they can go ahead and push it to historical as well?
Yes. Mm-hmm. And that's exactly right. So now that we have this new discontinue window, that allows us to move the medication over to historical and tell the pharmacy to also discontinue if that pharmacy has RX cancel enabled. So a little bit of change there.
I have one more question that I've seen come through, but now I'm trying to find it. It was from Sharon. Let me see if I can come up there. I've seen it pop up, but now I can't find it in here, Sharon. So if you want to retype it, see if I can answer that for you. Can meds needing prior authorization be sent to the nurses to do the prior auth for the provider?
Absolutely. So a great new feature as part of version 11.2 also is a prescription work list. And if a medication is entered into the patient list but not sent, it is saved into a queued list. We can access that list from the patient's record or from anywhere while we have partner patient records open by accessing that work list. In the work list, we can select the prescriber that I'd like to see the pending prescriptions for. If I am, let's say, working for Dr. Smith and I'm working the prior authorizations, I can go into that work list and take a look at any of the patients that have a pending medication for Dr. Smith and begin to work down that list. So anybody that is at the practice helping to work these types of meds can do so. There will be a presentation probably in the next couple of weeks that we will go over some privileges that allow the users to be sure that they can click into certain prescriptions for the prescribers and make sure that the authorized users for each prescriber are given access. So we're allowing everybody the opportunity to state who in the practice can work those prescriptions on their behalf. Great question.
Sharon also asked, is if a provider's on vacation for a week, is there a way to the provider to forward the RX inbox to the provider's covering? I think that kind of still falls under our work list, correct?
Yes, great question. So absolutely, we'd want to make sure that the prescriber that is covering for the one that is out of the office is an authorized prescriber on behalf of the other. And all they'd have to do is go into the prescribing work list or the RX work list, and from the drop down at the top to select a prescriber, they'd select that other person's name that's out of the office, and they can work their list for them.
Good. That's all the questions I have right now.
Great. Well, I know this was certainly a lot of information to cover, so we will talk about it more and go over things more in live demos as we get closer and closer to our release and have more and more of the functionality ready to go. But this is some great new functionality coming soon, and I hope you enjoyed learning about it. And if you think of questions later on, feel free to let us know. This presentation as well as the recording will be posted to the support site. So thanks so much, everyone, for taking the time to spend with us today.
Thanks, everybody. Have a good afternoon.
Thank you, everybody.